Good morning and welcome to today's Dr. Anyoha's podcast. Today's podcast is about the social sophistication of 9 months old infant. Inspiration, as usual, came from an infant that I saw days ago in a clinic. This infant came with mom for a routine health visit, and as I was having a dialogue with mom, the infant was hyper-focused on me, and I could see that he's paying attention to every sentence I make as I talk with mom. His intensity of focus was palpable. So he watches me talk to mom and watches mom respond to me. So he was shifting between me and mom, and very discerning child with super focused on trying to read my affect and what I was trying to talk about with mother. So that is the social and emotional sophistication level of a 9-month-old infant who is on a normal or adequate developmental trajectory. So that's what we expect to see in 9 months old. Very, very interested in the environment. They want to know what you're doing. They want to know what people around them are doing. If you look at something, they want to see what you're looking at. Okay? If their caregiver looks at somebody walking around, they want to see that. If somebody enters the room and the caregiver looks, the infant wants to take a look and see what the caregiver is looking at. This is called joint attention. In other words, they want to join you in whatever is attracting your attention at a particular time. And they also checks out with the caregiver for their social engagement or locomotion engagement. For example, if Uncle Joe comes in and wants to pick them up, they first of all checks with parents, caregiver with mother, reads their social or facial affect, and if the mother says that is okay, then he goes to Uncle Joe. So the infant at 9 months is always trying to read facial expressions of caregivers before they participate in social engagement, even walk to different places in their movements, in whatever they touch and whatever they eat. They're checking out, reading out facial expression of caregivers. It's called social referencing. So an infant who's 9 months old is very, very sophisticated in reading facial expression and also watching whatever is going on in their environment. This is very important assessment of trajectory of development in the social and emotional realm of a child. Very, very important. It's concerning when an infant of that age is not interested in the environment. If they're turned off from the environment, that is very concerning. If they're not interested in what the caregiver is doing, if they don't have joint attention, like I said, if they're not interested in what you're looking at, if they're not reading facial expression to check out for if it's okay to engage or disengage, it's concerning. So as a physician, as a pediatrician, especially one who is trained in infant mental health and childhood development, I'm always keen in assessing these milestones, especially when a child is at this age, which is 9 months. And if a child or infant is not meeting up with this milestone, it's important to further evaluate these kids. Sending to experts, agencies like Birth to 3 would help you properly evaluate these kids in their home setting. And of course, it depends on the mood of the child or the infant at that particular time. A child who's hungry, an infant who's hungry, might not participate actively in this assessment. If the child is hungry, if the child just woke up, they might not participate actively. But it's always good to try to elicit some of these signs of adequate development across social and emotional realm at age 9 months. Another sophistication is that the 9 months old would look for objects. If they can't find it, they will look for it. They will go, if you put your stethoscope behind their back, they would follow your hands and your arms to see where you're going. So they're very, very sophisticated, and they're always trying to discover the environment and check other people's facial expression. Thank you so much. Now you know that 9 months old could be very social socially sophisticated. And if they're not paying attention, if they're tuned out, it is concerning, and it is time to alert the pediatricians or to call Birth 3 agency for comprehensive assessment of a child. Thank you so much. This is Dr. Anyoha. Please share this podcast with friends and families. As a pediatrician, I like to spend about 3 minutes or so observing an infant interacting with me and interacting with mother or caregiver or parents or even siblings and people around the room. I like to spend that 3 minutes to make my own observation, to do my own observation of the infant social, emotional development. I know sometimes parents fill questionnaires, but some of these questionnaires, I don't know how much attention parents pay in completing these questionnaires. Sometimes they can be biased, but I like that 2-3 minutes observing the infant myself and interacting to see what's going on a global basis, and any suspicion at all, any suspicion of delayed development, social emotional development, any delayed in that warrants referral for an early intervention. Early intervention is when infants are sent to experts, agencies in the field of infant mental health to properly evaluate them, to comprehensively evaluate them, help them in areas where they are not meeting up with the expected development, which is very important because apathy to environment is one of the early signs of autism spectrum disorder. So the earlier we refer infants to get help or get evaluated, the better the outcome of some of these conditions. More so, kids can be tested globally for hearing as well. Make sure they're hearing, because an infant who is not hearing, and who is not receiving information, who is not building up information. So hearing is very important as part of the evaluation for a delayed social-emotional development or delayed interaction. So by and large, an infant be interested in their environment, robustly interested in their environment, and the pediatricians and parents are obligated to watch for signs of lack of these development and to act as early as possible to help the child achieve these milestones. Thank you so much. This is Dr. Anselm